Welcome back to Achieving Unlimited Health. In our last episode, Dr. Cima explains how physical injuries progress into chronic pain and degeneration. Today, we continue exploring the physical side of the triune by focusing on stability and movement and what the body actually needs to recover and function long term. And we're doing something a little different today, where Dr. Cima is going to be walking us through the presentation he's previously made of the ultimate machine. He'll be walking us through and we'll be asking some questions along the way. And this episode is about moving beyond symptom relief and restoring the physical foundation of health, along with Dr. Cima's presentation. So, hi, Dr. Cima. I'm excited to be doing something a little different today.
Hi, Layla. So am I.
All right. Well, you could go ahead and get started. I'm interested to see this whole presentation of the ultimate machine.
Okay, good. Because this is going to make a lot of sense to a lot of people. And what we're going to do is go through everything so that this way patients or even anybody, just general population, get a really good understanding of what's going on. Because in today's world, everybody's interested in like, oh, I have this symptom. What medication should I take? What vitamin should I take? I'm on this kind of a diet, that kind of a diet. And they totally neglect the physical aspect of the human body. Totally. And I'm not just talking about patients of mine, just doctors alone. They just don't think about the physical body as a machine. And the physical body is the ultimate machine. And as we go through this, I'll be asking some questions to get a good idea as to what you think is and isn't true or isn't possible. So every machine out there is a knockoff of the ultimate machine. Your computer is your brain. Okay. You have everything that goes on. Any physical machine that was ever made is a copy or a knockoff of the ultimate machine, which is your body. But it has to be maintained. People don't think that you should maintain your physical body. It's amazing how they go, well, I never had this problem before. Well, Mary, you were never this old before. Let's call a spade and realize that, you have to maintain your body. And if you don't, you're not going to go anywhere. And as time goes on, I can tell you this, you start getting into the 5th and 6th and 7th decades of life, and you wish that you had taken care of your body much better. So you need to basically maintain it and also condition it. And if you don't do that, you're not going to have the ultimate machine living as long as it should be and having all the qualities and characteristics of the ultimate machine. So let's carry on from there. So why is this, possible that we have to maintain and condition it? So if you really look at it, we're constantly involved with physical stress, traumas and injuries, falls and accidents, traumas through sports activities, and don't forget the typical car wreck that you can see that I don't think this person made it out alive, but these are the injuries that the human body goes through its whole entire life. So if you don't really address these situations, things will just progressively get worse as time goes on. So life is pain-free motion. And what I mean by that is that as you get older, you're going to start seeing that just getting up out of a chair is going to be painful. Walking is going to be painful. Doing a lot of other things is going to be painful. So again, life is pain-free motion. And if you don't have pain-free motion, you're going to have some big problems in life. And that's what most people don't understand. So if you have pain-free motion, that's what everybody wants. And you can see just from these photos right here, you can see like how the human body with the musculoskeletal system takes care of that whole thing. So again, when you look at it, everybody wants a body that is beautiful, pain-free, and functional. But if I ask just about everybody out there, are you happy with your body? Do you like the way it looks? Do you have any pain anywhere? Could you do things like just simple things like, just doing little sporting activities? And if you can't do any of those things and you don't have that beautiful pain-free body that you want, and by the way, most people don't have it. That's the biggest problem with this. Most people do not have these qualities and characteristics. And there's a reason for that. There's many, many reasons, but we're going to cover some of them. So let your presence command attention. I always said this to a lot of people. And when you walk into a room, does the presence of your attention command some kind of a situation like, wow, look who just came in. So this is based on your physique, your posture, the way you move, the clothes you wear. And if you don't really look at all these different things, what's going to happen is things are going to just get worse and worse. So what kind of a body do you want? And again, people like, I want a different body. I want to do this. I want to do that. So what would you like to change with your body if you could? What type of body would you want? Would you want a sleek body? Okay. Or you want a big, tough, strong body like a big football player? Okay. Or do you want an elegant type body? Or you just want your body, if you're in your 60s and 70s, to be like a reborn again classic. Okay. Most people don't get that. What they get is this. You can look like this, ready for the junkyard or the graveyard. And that's what most people's bodies look like when they start to get into their 60s, 70s, and 80s, especially if they didn't take care of it as time went on. So it's really your choice to basically do this. And if you don't do it, it's going to be a lot of issues that are going to go on and on. So we all want that perfect body. So when we blend the function of the physical body with its beauty, physical aesthetics, we get beauty and grace. This is why we experience awe when we watch a professional gymnast, quarterback, baseball player, basketball player, golfer, skier, surfer, or Miss America pageant. When we see the one person with the greatest physical development in a particular sport coupled with a functioning, graceful body, that person's beauty and grace mesmerize us. Not only is the physical fitness necessary for our survival, but it has a dramatic effect on our mental attitude. I'm sure that all people would love to have a beautiful body that is physically effective and efficient. But most people don't. And there's a reason for that. And we need to know what that reason is. So, can you imagine the exhilaration you would feel if your body could perform at a professional level in your favorite sport? Stop and think for a moment. If your body were able to perform this way, how dramatically would it affect your life? Some of us might be excited if you could walk a few blocks at a moderate pace, but just imagine if your body had very few physical limitations. Think about how much better and easier your life would be. You would have tremendous amounts of energy and physical strength, much more than you need to go through life. Your physical capacity should be 10 times more than you really need to survive. So this is really one of the causes of abnormal motion, and we just never realize it. It's like amazing. I talk to people all the time. They'll have neck pain or back pain, and they'll go, is there a medication or is there a pill that I can take, or is there kind of an easy way out of this? And it's no. We're affected by gravity, which when you fall from a high place, you start to realize how intense gravity is. So it's at 9.8 meters per second, which means that in a matter of 5 seconds, you're falling at 150 feet per second. It's a lot. But when you're just standing on the chair and you fall, that's enough to cause a lot of damage as well. So from injuries, traumas, talked about accidents, falls, sports injuries, excessive weight, which is a key today in today's world. And activities of daily living, the way you exercise, the way you do those things, and your age. And these are the things that you really have to look at. And your loss of strength as time goes on. So gravity has a real big impact on your physical body, and it's around you 24/7. And people don't even think about it. They're thinking, well, my diet's off, or this or that, or this or that. And it's just gravity pushing you into the ground 24/7. And not only pushing you into the ground, but it's also causing problems whether you're sitting, whether you're standing, whether you're walking, whether you're lying down, all different things has a big impact on that. So, and you lose a lot of flexibility as well. So things you need to know about your physical body, and most people don't. Did you know that in the human body, there are 100 trillion cells? And I always tell people those 100 trillion cells goes through 100,000 chemical reactions per second. So therefore, you think that you know everything, and you think that, well, I can control everything, and you can't. There are 206 bones, 379 joints, and 900 ligaments. So the goals of the treatment or the care of the human frame or conditioning of the human frame are exactly different. You have to care for the human frame and not think that, oh, I'm just going to go out there and exercise and everything's going to be fine, because you're wrong. That's never going to happen. You have to take care of the human frame first, then you can condition it. I see people have physical injuries and they want to go out and they exercise. They can't. You can't exercise a joint or joints in the body that are damaged or traumatized and think that you're going to go out there and utilize those and work out and think you're not going to have more problems. It's like trying to race a car on a racetrack that needs a tune-up, that needs a front end alignment, and the tires and ball. If you think you're going to win a race with that, you're crazy. And like I said, most people out there are a little bit on the crazy side when it comes to the human frame. So how do you perfect the perfect human body? So how does pain, arthritis, and degeneration develop? See, again, most people go, oh, I got pain. I got arthritis. It's like the arthritis is not causing your pain. The arthritis is something that the body lays down in the form of calcium that helps to try to protect that particular joint. So arthritis is the way that the body protects itself. It's not causing the problem. The problem was already caused by some kind of trauma or degeneration or damage prior. So if you look at it, could take place anywhere, in your hip, in your feet, in your hands, in your spine, in your knees, anywhere where there's a joint. And you can see like all these different particular areas that you have to, look at and think about when you're starting to develop some kind of degeneration. So now this is how arthritis begins. You have a typical joint and you see the figure 1 on the left. Okay. You'll see that it's composed of these 2 bones held together by the ligaments. Ligaments attach bone to bone, and then muscles attach by tendons and span the joint. And these little yellow things here are the nerves. So when the nerves cause the muscles to contract, as long as the joint is functioning normally, you're going to be in good shape. When you have trauma to the joint, if you look at figure 2, then you start to see some tears in the ligaments, some tears in the muscle itself, and even some tears in the tendons. When you develop this situation, that's a typical way that has arthritis is going to develop many, many months or maybe a few years prior to this particular injury. Sometimes it could be 10, 20, or 30 years later. So how does arthritis begin? Here's a picture of the spine. Now that's the back of the head and there's the jaw. And you can see that in the spine, there's a curvature, a forward curvature, and between the vertebrae, there are discs to act as shock absorbers. What happens is as time goes on, the spine goes in reverse. When it starts to go in reverse, then you start to develop a certain amount of stress and trauma into those joints. And then you'll see by the third picture, you're going to start seeing joint damage, and not only joint damage, but you're going to see disc degeneration and so on and so forth, and also vertebral malformation as well. And then when you get into this level, it's even worse. Now it's starting to fuse. Now it takes a long time to do that, but it will definitely occur as time goes on. So if we look at a normal to abnormal, you see you have the near normal, no subluxation, followed by a reversal of the curve. And then after that, that'll take anywhere from between 0 to 20 years. And then once you get into that phase, then you're going to start to develop more connective tissue damage, and then which are your muscles, tendons, and ligaments like we talked about, and you're going to start to develop pain. When you start getting to this point here, then you're starting to get to a position where you're going to start to develop a lot of arthritis. And the purpose of the arthritis is the body's laying down calcium to protect itself. And since it does that, people think that, I have arthritis and that's the cause of my problem. It's not. It's definitely not. And again, you can see like here's normal disc, there's a degenerated disc, there's a bulging disc sticking out the back. So you have all these different kinds of disc problems, whether it's a herniation, a bulging, or degeneration, or the thinning of the disc. So now we have the herniated cervical disc. So you'll see where a disc can be herniated, as you see in this figure right here, and you can see how it bulges out and puts pressure on the nerves coming out from between the spinal segments, and then causes pain. And depending on what segment is involved, it's going to cause pain to particular areas. So if you see like problems with the neck, C5, C6, C7, you can see how the pain will radiate down into the arm and into the hand. So that's typically what happens. So patients will come in and go, I have neck pain, but I also start to get this tingling down my right shoulder or my right hand, or I lose function, or I lose strength in that. And that's because you're traumatizing those particular vertebral levels. You might be traumatizing the disc as well. And that's why you're getting that radicular type pain that you see with most people. So you can see right there, again, herniated discs are a really, really big thing. And most doctors want to just basically do surgery. They don't want, they'll do a little physical therapy, but their goal is to do surgery because they think that that's the only way to handle the situation, which is usually not. I see so many failed surgeries. It's really pathetic. And if you want to do that to your spine, then you go ahead and do it. But that is not the recommended treatment that I can see at this particular point. So again, you can see lumbar disc herniations and all the rest. So, and you can see with the disc degeneration, even with this one here, there's a normal disc, there's a desiccated, degenerated disc. And you can see how the vertebra itself is starting to lose shape and starting to lose size and height. So, and the same thing with the low back. You have dermatomes coming from your spine, and it basically goes down into the leg, into the butt, and to the feet. So if you're having pain down the leg or pain down the side of the leg or pain in the knee or pain in the ankle, it's because these dermatomes are really impacted. So, again, this is what you're doing. You're going from, a phase 2 to a phase 3, which takes another 25 years, and you're starting to develop more degeneration. And now it starts to fuse. When you get to this point or that point, there's just so much you can do with the human body, but you can still do enough where you can still be functional, still be pain-free, and still lead a normal, productive life. Okay. And then here's what this degeneration on an x-ray looks like here at C5, C6. And you can see on an MRI, you can see the herniations right out there, C5, C6. And it puts pressure into this black thing coming down, which is your spinal cord. And it causes a lot of pressure on the spinal cord and it affects all those nerves coming out of that area. So, how would you like to carry a bowling ball now with you every day? Again, people don't even realize this. This is really amazing because I have so many people coming in with neck pain and they don't understand why they have it. Well, your head weighs this weight of a bowling ball. Okay. So it's usually 12 pounds, but every 2 inches that your head moves forward. And if you look at elderly people, and you don't have to look at elderly people, you just look at the average kid today because he's on his cell phone or she's on a cell phone all day long with your head bent over. Every 2 inches forward creates another, 22 pounds of weight on your spine.
Wow.
When you go 3 to 4 inches, now you're looking at 42 pounds of pressure on your spine and your neck. And if you literally watch people as they go through the aging process, when they get into their 60s or 70s, their head is so far forward that they're literally falling forward. They're not walking, they're falling forward. And they can't really, their balance is off and everything is just going to progressively get worse as time goes on. And that's what I see. I see that 24/7. It's not like something that's new. And these patients come in, they can have neck pain, they can have headaches, they can have all kinds of issues because of it. They can have a lot of stress on their heart because the nerves that come out of this area of their spine affects their heart. So here's a posture with cell phones. This is a typical X-ray. Look at what this person looks like. They're in that position all day long, and just watch people. They're on their phones constantly, and they're always looking down. And the more they look down, the more they stress the neck out, and the more they create abnormal curvatures in the cervical spine. Not only in the cervical spine, but also creates a kyphotic, or what they would call a hunchback, okay, in the upper thoracic area. And people, when they're walking around like this, there's no way, shape, or form that you can be functional. There's no way, shape, or form that you can be pain-free. And there's no shape, way that you could ever be, have a nice looking body because your whole structure is totally off. So now that's up in the neck. That's typically what happens up there. I want to show you like typical problems that most people have. Most people with low back pain, it's a sacroiliac joint problem. That's what it really is. It's a sacroiliac. It's not a disc problem. Disc problems don't, create the problems that sacroiliac joints create. And I'll explain that in a second. But most of the people that I analyze, they'll come in and they'll go, oh, my MRI shows I have herniated disc. That's great. The cause of the herniated disc is sacroiliac problem. Chances are most of the time. And all doctors ignore that because you can't do an MRI on the sacroiliac joints. So they don't. But if you look at it, Here's a sacroiliac joint. You have ilium, sacrum, sacroiliac on the left, sacroiliac joint on the right side. Okay, and this is where, the rubber meets the road, so to speak. Because if you look at everything, you'll see that the sacroiliac joint is surrounded by really strong, tough ligaments, because it's got to be the strongest because it supports the weight of the whole entire body. And if you don't basically take care of that, the ligaments will start to tear. And they're going to start to, get to a point where they're going to get weak and get inflexible as well. And I'll show you how easy it is to do. So
And
look at, again,
with ligaments, so is that why it's so important to critical joint health? Because like you just said that they'll tear. Why do you think ligaments are so critical to joint health?
They're very critical because they hold the joint together. They're like rubber bands, but they don't get a good, they don't get good blood supply. So it takes them longer to heal. So if you traumatize, sprain a joint, so to speak, it could be your elbow, it could be your knee, it could be your shoulder, or whatever. It's sometimes if you ice it and do some things like that, it'll help. But if you don't get those ligaments to heal, then nothing's going to happen. It's just going to progressively get worse. And that's what I see with a lot of people. I see that they had a sacroiliac problem for decades, but they weren't able to do anything about it because no doctor told them anything about it. So they just think, well, it's a disc problem, and if I take my anti-inflammatories, my pain medication, and I'm kind of good to go. And you're just making a worse situation worse. That's what you do.
Do you think that it's often common that they're overlooked when it comes to rehab or?
Absolutely. And even when you go for rehab, a lot of times they'll say, okay, you have a problem with the left knee or the left hip or whatever it is. And that's all they'll rehab. They won't rehab the left knee or the right hip, or they won't rehab all these other areas that are involved with this particular joint. So your knee joint on the right hand side can affect your ankle joint, and your ankle joint and the knee joint can affect the hip joint, and the hip joint can affect the sacroiliac joint. So it's like a kind of chain reaction. And whatever happens on the left side, you have an opposite equal reaction on the other side. So by not working on the other side, you're basically, creating more and more of an issue as time goes on, because you're not going to be able to stabilize that sacroiliac joint. And I'll show you how intense this really is, because as you'll start to see how easy it is to traumatize that joint. So these are all the muscles. So when I'm checking patients out, I'm checking out the piriformis muscles, the obturators, the hamstrings, quads, tensor fasciae lata, iliotibial band. Every particular muscle that I can look at to check would be impacting that joint. And most doctors don't do that. They're not interested in that. They just want to give you an injection there, and okay, this will help. You take 2 or 3 injections here and you'll be pain free. And the patient does become pain free for a while, but it comes back. You can't correct a physical problem with a chemical. Again, I always say this, you can't, if the refrigerator is broken, you can't work on the stove and think you're going to help the refrigerator. And that's what doctors and patients think constantly. And it's really ridiculous that they think that way. So they have a lot of muscles that are attached to the sacrum and the ilium, providing stability rather than movement. So you can kind of see there's a picture right there of what's going on. Okay. And then you can kind of see how a sacroiliac problem can cause herniated disc, because the sacrum is the foundation for the L5-S1 disc. If the sacrum tilts out of alignment, puts pressure on the disc, and eventually it'll cause that disc to herniate. And once it herniates, then they're going to want to go in and they're going to do surgery. And even though they do surgery, they don't correct the sacroiliac joint, which was the cause of the problem. That's why a lot of these surgeries fail. They're temporary because they're not getting to the cause. They're getting to something that occurred because the cause created the problem, but they're not getting to the cause. So if you really look at this, the sacrum is the foundation of the L5-S1 disc. And when this foundation tilts, disc herniates or ruptures, which I just said. So the sacroiliac joint can cause sciatic pain or pain down the leg, which a lot of people do come in with. And they think it's sciatica, but most of the time it's really not. It's usually pain down the side and the front of the leg. A true sciatic type patient will come in or have this burning sharp pain down the middle of their back of their leg. And it may go all the way down to their calf or their ankle. So, but most of the times I see patients, because the sacroiliac joint goes out, it has a big impact on the sciatic nerve or the other nerves around, and also the other muscles as well. So, and also causes scoliosis. If you really look at a lot of scoliosis, especially with children, okay, that sacroiliac joint goes out and it'll cause a, really bad scoliotic pattern in a child. And if that's not taken care of, as that spine grows and starts to calcify, you're going to start developing a bad curvature to one side, maybe secondary curve, or even three curves on the spine. But it's not really good for a growing child to go through that. And what they'll usually do is that they'll look and see like, okay, make sure this curve isn't getting worse. And they don't want to do anything until you're like 15 to 18. Some doctors will create a mold so you can kind of, wear it like, 5-10 hours a day, but that's, very, very difficult to do. But eventually they might want to put a Harrington rod in there to try to straighten the spine out. And when they do that, they make something that each vertebra moves independently. Now they can move independently. So it really impacts your overall health, your overall life, and, whatever you're going to be able to do as time goes on. So again, you can see like how bad a scoliotic pattern can be by just looking at this child. And this child could be more than maybe in early teens. And you can see what the spine looks like in x-ray. And that's what you don't want to create. And the way you're going to do that is through some of the things I'm going to be talking about in a few minutes. So why are sacroiliac conditions so prevalent? This is what really happens. This is what people don't understand. First of all, we stood upright 2,000 years too soon. So we're the only species that does that, which is interesting. Okay. 2, massive physical stress. And I'll give you an example on that. Okay. We have 2 legs and 1 pelvis. And so if you do the math, so if a person's weighing 150 pounds, each leg supports 75 pounds. Each sacroiliac joint, I should say, supports 75 pounds. But if you stand on one leg, okay, then that 75 pounds becomes 150, which is your weight. Okay. Which I just said right now. But now if you start walking, it increases by 2.5 times. So which means that now each sacroiliac joint, every time you take a step, is 375 pounds of stress into your sacroiliac joints. And so today the big thing is like walking. I got my 15,000 steps in today, or my 20,000 steps. That's nice. You know how much trauma you put onto the sacroiliac joint doing that if you don't take care of it and do well? And the same thing, 1/4 each step into each sacroiliac joint. Jogging, it's 3.5 to 4 times your body weight. So now you take a person weighing 150 pounds, and now it's close to 600 pounds of stress into the sacroiliac joint. So you have all these people jogging out there, and most people I see like jogging, they look like wounded animals running down the street. So it's like, why are you even doing that? You're destroying your physical body. But they say, oh, I love running. That's good. Why don't you just love banging your head into the wall too? And you can create a lot of headaches with that too as well. But again, you have to really condition your body. You have to really treat your body before you can start doing these things. That's what kind of stresses you put on your body. 300 pounds would exert 7,500 pounds of stress into your pelvis. So you got these people that, weightlift. And then I was a bodybuilder. I was actually a powerlifting bodybuilder. So to me, it was go as heavy as you can and do as much as you can, which is not so good for the joints of my body. But thank God I knew how to how to take care of my body so I didn't have everlasting trauma and damage to it.
So is that why, is that why you would say why someone or how someone moves matters more than how much they move?
Correct. Yeah, correct. Yes. Yeah. Because if you're looking at look at a gymnast, 100 to 120 pounds, they'll land with approximately 1,900 pounds of force into the sacroiliac joints. So it's this stuff over and over and over and over again that leads to, severe trauma to the ligaments, tendons, and muscles. And if you don't treat that first, you're going to wind up injuring yourself, and you're going to you won't be able to do certain things. And then eventually you won't be able to exercise. Eventually you're going to have to go for some kind of a surgery. And that's one of the last things you want to do. But people say, well, I never want surgery. It's like when the pain gets bad enough, you're going in. That I do know. So you want to prevent that from happening. And the key is to get that sacroiliac joint, along with the cervical spine in your head into a proper position and a proper, way to stand and be, have everything level and having your center of gravity in the right place and taking a lot of stress off your spine, your neck, and the sacroiliac joints. So not to mention, we falls constantly. Okay. You can see this all the time. And we talked about auto accidents. These are things that create it. Also, your posture. We were talking a little bit about posture. As we start to, get up into our 20s, 30s, and 40s. And I see this now more than ever. And by the way, that's why we're called the United States of obesity, because you have, I think it's 74% of the people are overweight, 44% are obese, and 24% are morbidly obese. So you can look at this as a small little child, and then all of a sudden starts growing, and you can see the belly and the butt and, just right down through there, and it throws our posture off and further aggravates a lot of other things going on with the pelvis. Okay. So that's a big thing that I do see. I mean, besides the cervical spine, the sacroiliac, those are the key factors or the key joints that really have a big impact on overall, let's say, condition that you want to create for your bodies to basically be normal again. Another big area that I see with a lot of people, and they don't even know about it, it's called temporomandibular joint dysfunction. But just watch and see what's going on with our population today. People in their 60s and 70s, they're losing balance. Okay, they're having ringing in their ears. They're losing their ear. Okay, they're having massive headaches besides jaw pain and all the rest. You don't realize that there's one joint, it's called the temporomandibular joint, which is right here. And these are all the muscles right through there that basically cause a lot of issues with your whole cranium. Now, again, most people have no idea that the cranium moves. Did you know that the cranium moves?
I was just going to say I did not know that.
No, most people don't. And what happens is that, when you're born, most of your cranium is just cartilage and membrane. But by the time you're 28, all that cartilage and membrane becomes bone and starts to literally fuse. So all these bones kind of interconnect and they create these joints like pieces of the jigsaw puzzle that come together. The cranium is supposed to move when you breathe in and it's supposed to move the exact opposite way when you breathe out. And by doing so, it causes the flow of cerebral spinal fluid and blood to circulate to the cranium properly. If you throw off the TMJ, you start, like I said, develop headaches. I had one of my patients come in today. She has a TMJ problem and also a cervical problem, but she's got problems with ringing in the ears, got some problems with balance, and she gets some severe pain in her left eye. Okay. And then she gets this kind of streak that goes through when she turns, another way or she turns her head I think it was to the left. So I was explaining to her about the cranium and how it moves and all the rest. And after we finished with the treatment, she felt so much better because she was getting these migraine headaches and all the rest of that stuff. So that's a real big one. So causes of TMJ, clenching your teeth, chewing on one side, improper dental work, braces, extractions, bridges, loss of teeth, hit punch in the jaw. In fact, the interesting thing, before I ever learned anything about the TMJ from a medical perspective, I used to box when I was a kid. And when you want to knock somebody out, what you want to do is you want to hit them right there. If you hit them right there, it's done. It's finished. It's over. They're the lights out. They're knocked out cold. So that was the goal of trying to do something with when you were boxing somebody else, and you can kind of end the fight immediately by hitting them that way. So we talked about all those different things that can cause it. So look at every one of those things. Most people do. Most people are unilateral chewers. They'll chew on one side. And it's because they might have some pain when they chew on the other side. And that creates more of an imbalance too with all the muscles of the jaw as well. So
would you say that TMJ is something that's more common as you age?
Yeah. But also, again, I've seen, kids who they were put into braces. See, a lot of times the goal of the orthodontist is to realign the teeth. But if the jaw is out of alignment, when he realigns the teeth, he keeps the jaw out of alignment. And it gets worse. So, but that's pretty much what's going on as far as that goes. And these are the typical things that I see in the TMJ or the cranial thing. And we'll show you in a few minutes how important that really is for good health and good function of the whole body. Because in the cranium, and this is what I don't understand, a lot of chiropractors don't even do this work. Why? I know why. They're lazy. Okay. But with that being said, it's like you do well as a chiropractor working with 15% of the nervous system. 85% is in your cranium. You think you should basically be doing some cranial work too as well? Absolutely. Okay. Absolutely. So these are some conditions caused by TMJ. Jaw pain, difficulty chewing, facial pain, the tic de la rue, I think that's spelled properly, facial paralysis, Bell's palsy, headaches, migraine, clusters, balance problems, hearing loss, ringing in the ears, problems with their eyesight, sinus conditions, hormonal because most of your endocrine system, your pituitary, pineal, and hypothalamus are in the brain. So it can control your follicle stimulating hormone, luteinizing hormone, which then controls estrogen, testosterone production, and all the rest, smell and taste as well. So just by having TMJ problem, you can have all these different kinds of symptoms. And you'll go to the doctors and they'll check you out and they'll go, we don't see anything. We did an MRI. We did a CAT scan of your brain. We did a canary, scan of your brain. Nothing worked. No, we didn't see anything. Nothing's going on because this is the cause of the problem. And they can't pick this up with their MRI or their CAT scan or all the other, scientific mojo that they give you at this particular point. So, but these, like I said, most people, if I check them, definitely TMJ. If I check them, definitely sacroiliac. And if you look at their head posture, you can see this definitely way off. Either that one shoulder's lower, and I'll have them look in the mirror, Layla, and they'll say, "What do you see?" And they'll look and they'll go, "Wow, my left shoulder's really low." I said, "You never noticed that before?" No, I never noticed it before. What do you do every morning when you look at the mirror? I mean, what are you just doing your hair and stuff like that? You got to look at your posture. You got to look at all these other things. If you can't see that, other people see it. And that's what's causing your neck pain or, your problems with your upper back or your shoulder or whatever it would be. So that's what conditions caused by TMJ can do. So we treat all these different kinds of things. That was my goal when I was, starting my practice. It was like, I learned I wanted to work with the whole body. I wasn't interested in just like being a chiropractor and looking at the spine and saying, okay, I'll just adjust that vertebra and adjust this vertebra, which like 90% of the chiropractors do out there, maybe more than that. And they just don't get to all these other different things that we treat. And it's really sad because if you can do these things, you're going to help many, 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 many more patients. But more importantly, and I tell this to a lot of the chiropractors I say, you know what? If you don't learn this stuff, one day, guess who the patient's going to be? You. And when the patient's you or a loved one, then you're going to wish you had been able to do all this stuff because you're going to be suffering with all these problems. And it's not like if, it's just about when it's going to happen. So we do all kinds of different kinds of treatments. So for example, we do a lot of what we call neuromuscular re-education. We work with all the muscles in the body. I don't care if it's your back. I don't care if it's your knee, your ankle, your shoulder. We check every muscle on the whole entire body. And wherever there's problems, the body will let us know. So, and we do this constantly, and we do this for, anything that's damaged to muscles, tendons, ligaments, and joints, which we talked about, chronic pain, strains, sprains, tendinitis, bursitis, and joint degeneration. So just by doing neuromuscular re-education, you can help correct a lot of these particular problems that people do have. Okay. So we also not only do that, but we do physical chiropractic care too, like we said, for herniated bulging disc, degenerative arthritis, pain and numbness, extremity pain, shoulders, elbows, or wrists. We do all that stuff in hip, knee, and foot problems. So we do the physical treatment as well. Then we also do work with the cranium. In fact, I wrote a book on cranial concept. There's a picture of it right there, which explains to doctors how they can treat all these kind of cranial distortions that can come along. Just think about this for a second, Layla. Just when you're born, you know what kind of stress you're putting on your cranium when it's going through the birth canal? I mean, even on a fairly, you know, normal birth, okay, the amount of stress and forces on the cranium can definitely put pressure all over the place, and then literally cause problems from that point on until the day that these people die. So the cranial concept and anti-aging is really good. And I wrote that book probably 30, 40 years ago. So
Hmm.
with cranial therapy, these are all the different things you can treat. Headaches of all types. I can't tell you how many people have it, and they live with it. And like, they don't have to live with them, but they do. Well, they do because they don't know about all this stuff that I'm talking about. Equilibrium, balance, are very important when you get older. Allergies, sinus conditions. Everybody and their mother has allergy and sinus conditions. I see it all the time. TMJ, like we talked about. Seizures. I can't tell you how many children I've helped with seizures throughout the years and the decades. Blood pressure problems, sight and hearing problems, Bell's palsy, where your whole face starts to droop, and they'll say, well, there's nothing we can do about that. Just wait for 7 months. And it usually takes care of itself. So you got to walk around with a drooping face on one side for 7 months. Okay. And, if you're, kind of in business, you don't really look like, something of a horror movie, but that's what you look like. So these are all the different things we do with cranial therapy. Also, trigeminal neuralgia, facial pain. That is horrible when people, I think that is like either the first or second worst pain you can even think about, trigeminal neuralgia. Okay, I think Diesel's crisis, passing the stone, is number one. But that's how bad that is. Okay. Also, visceral reflex techniques. There are techniques that we utilize to help people that have problems with their liver or their colon or their small intestines or their heart or their lungs. It's all the different things that we can do. And I wrote books on that too as well. And I wrote those books back, decades ago, because I knew how important this stuff is and then usually teach it. But again, most doctors are not interested in doing it until it's them or a loved one that has a big issue. And so there are a lot of people out there that never even heard about visceral somatic reflexes, or visceral visceral reflex patterns, because nobody teaches it. Nobody talks about it. When I first learned these things, I was still in chiropractic school, and my anatomy and physiology and splachnology and myology and everything out there was like, I knew everything perfect inside and out. So when I went to the seminar and they were talking about how these reflex patterns develop between the spine and these organs and what you check for, it's like, it was all neurologically perfect, all physiologically perfect. And I'm like, why don't doctors do this?
Hmm.
Well, instead of doing surgery where they're going to cut out part of your stomach or cut out 3/4 of your liver or 3/4 of your colon, why don't they just attempt to do this first, way before it gets to that point? And they just don't do it. And they weren't doing it back when I learned this back in 1976. And what is it now? 50, 60 years later,
Hmm.
still nobody does it.
Yeah.
I said most people don't. And, and even when you talk to doctors about this, they have no clue what's going on. Zero clue. So we do, again, organ work, and we treat things like high blood pressure, digestive problems, ulcers, immune system weakness, lung conditions, irritable bowel syndrome, menstrual conditions. And you see so many women coming in with menstrual problems. And it's like, if you work with the sacroiliac joint, because that creates the true pelvis, you can create a lot of changes with, your menstrual conditions, whether it be pain or, flowing way too much or way too long, even losing a lot of blood, kidney bladder situations and all the rest. So we work with the organs, we work with the muscles, ligaments, tendons, joints, bones, cranium. We do it all, because the physical body is made up of all those parts. And the beauty about this is when I'm checking patients, Layla, for these problems, and I always say this, the body doesn't lie, doctors do. When I palpate and check different muscles, you can see, like, the one muscle you check, you palpate, and the patient's almost flying off the table. There's so much pain there. And then you check the other side, and there's nothing. And so that's the body telling you that there's a problem. And if you basically listen to the body and think about what you need to do, and if you can take that muscle or those muscles that are in severe spasm and causing pain and get them to relax, you just make that patient so much better, symptomatic. that they just love it. So most of my patients, even when they leave after each treatment, they definitely feel better. Just from doing that. And so we don't wait for like, weeks or months of treatment to see results. We see results pretty consistent, pretty quick. And if it's a simple case, it's real simple. But then we got, the cases that come in and they're really chronic, that are really bad, they do take a lot more time. But that's what we work with. That's our goal, is to work everything out physically. If we can do that, then it's going to be great. And what controls all the organs and glands in the autonomic nervous system is what we work with. And, today the big thing is, the vagus nerve. Everybody's into the vagus nerve, the vagus nerve, the vagus. I've been doing vagus nerve technique since 1977, 76, somewhere around there. And, now it's a big thing because it's part of the autonomic nervous system. It's the parasympathetic portion. And that, by the way, it comes out of your cranium. And right where it comes out of your cranium is right at the temporomandibular joint can have a big impact on that too as well. But so we can stimulate the sympathetic portion, parasympathetic portion. This is autonomic. Everything works normally without you thinking about it. If you had to think about your stomach digesting things, you'd probably be dead in about 5 minutes. So this is automatic. It's done normally. And as long as the sympathetic and parasympathetic nervous system, kind of like balance, because they're literally always at a tug of war with each other. Like when you run down the block, the sympathetic's going to kick in. But when you stop running, you want your heart rate and everything to start toning down, and the parasympathetic will start kicking in. So it kind of creates this tug of war, but the balance is always there all the time. So you have to really understand the autonomic nervous system. You have to understand the peripheral nervous system, the central nervous system. And if you kind of understand all those different things, you can watch and see how the body reacts and responds. And like I said, the body isn't stupid. It knows exactly what to do all the time. And, again, people, think the body, well, when I'm in pain, it's like, oh, my dumb knee, it's my dumb this. It's like, no, you're dumb, not the knee. He's telling you got an issue there. And so the body's, goal is to warn you. And by you taking drugs to kind of counteract the pain or the inflammation, it's the worst thing in the world to do, because it just accelerates everything as time goes on. So,
And with the nervous system, what does it mean to retrain the nervous system? And why is that an essential part of physical recovery?
well, yeah, what you really have to do, yeah, because what happens when you damage a joint in the body, one of the things that happens is that, you literally cause neurological impulse to either increase to certain areas or decrease to other areas, because you might get like, for example, numbness or paralysis and things like that. And it's all based on the number of neurological impulses per second. So when you're looking at all these different things, you'll start to see, okay, well, there's a problem with the joint. It's going to affect the nerve supply, and not just to that joint, but all over. So you're going to have to basically look at that as saying, okay, I need to do this. I need to do that from a physical treatment perspective. Once you treat the body physically and you get it functioning well, then the body will basically now all neurology will go back to normal, and the body will be able to do what it was supposed to do way back when. And like I said, I'm not sure if I must have said this prior, but how I got into chiropractic was because I hurt my low back and shooting the shotgun. And it was basically, at the time, they thought it was a congenital defect. And it turned out that it wasn't. It was, due to the physical trauma on my part. But I was at the point where I just couldn't get off the floor. If I had to go to the bathroom, it would be like, how do I get there? And once I get there, what do I do? And I remember times laying down and saying, if my house was on fire right now, I couldn't get out. I'd have to like crawl to the window and throw myself out the window. Otherwise, I just burned to death. And as I got into my 20s, it was getting worse. And, I was, one day I was at my girlfriend's house, and she said, I was with her, and her father's friend walked by, this rough Italian guy, and he goes, "What's wrong with you?" I said, "My back is killing me." He goes, "It's going to get worse as you get older." Steps over me and walks out the front door. And I'm like, my first reaction was like, what my first reaction would be, but I said, he's right. I'm 23 at the time. It's like, It's getting worse. What do I do? I don't know. It's in general, doctors are telling me there's nothing that can really do, but maybe put some hot compresses on that. And I said, I'm not doing that. I got to figure out a way to do this. And fortunately, I was, you know, I was, let's say introduced to chiropractic, and I said, I'm going. And I just changed, I was a pre-vet major. Wasn't that much a difference becoming a chiropractic physician because it took all the basic sciences and all the rest. But I said, that's what I wanted. I said, if I can help people with low back pain, that to me would be just my gift from God. And that's exactly why I chose this profession. And a lot of it's, because the physical stuff in today's world, everybody's talking about vitamins and minerals and hormones and now the big thing out there is, they want to start doing, things with all different kinds of proteins and things like that to try to make this change, try to make that change. And most of the problems they're talking about are physical injuries. They're physical. I was like with like stem cell. That's another big thing that they do. They inject cells into your joint to basically help repair and rebuild the cells that create cartilage. And so they'll say, okay, and I say, well, what causes that? They go, well, aging. So they'll say, well, you got a problem with your left shoulder, right? But you don't have one with your right shoulder, right? Yeah. So isn't your left and right shoulders the same age? Why is one aging and the other one isn't? And it's because of trauma. It's because of injury. So even stem cells, if we don't treat the body the way I just told you, it has to be treated. This is not just coming from like 2 years of research or 3 years of research. And I read a few books. This is like 50 years of not only teaching it, treating it, writing about it, living it, everything that you can possibly think about. And what I see is going on with the medical establishment is it's getting worse and worse and worse and worse. They just want to do more drugs. They want to do, more peptides and this and that and that and this. And they're not getting into the physical, cause of all disease. And the more I see even these gurus on TV, they're always talking about nutrition. They're talking about, oh, you want to sleep better? Take this supplement. No, that ain't going to work. I didn't go through all this study and learning and understanding to think that if I just take this supplement, I'll be fine. But it's the Supplement of the Month Club. It's been going on since the early 80s. They're pushing supplements. Or you can sleep better with this. You want to sleep better? Your cranium is locked up. Get your cranium taken care of and treated. You'll sleep like a freaking baby. Okay. You won't even want to get up. So it's kind of like I see this all the time. And people are just always stressed out. And especially in today's world, people are stressed out of their mind. And so mentally, emotionally, and that tightens everything up. When you're stressed out mentally, emotionally, you're clenching your teeth, you're holding your body in a certain posture that dictates what that emotional state is, and you just get worse and worse. And you don't realize it. And I have patients coming in. I had one in yesterday. She's coming back tomorrow. She was having chest tightness. She was having anxiety. She thought she was having a heart attack. She was having severe neck pain. And she was kind of like, I can't even focus anymore. And she's in her late 40s, early 50s. And I started treating her and she was still so much better because she was like, when she was getting chest pain, she couldn't breathe. Next thing you think that, am I going to die? Am I going to have a heart attack? And then your mind starts to wonder or wander and start thinking about, well, maybe I'm going to die tomorrow. Maybe this. So what am I going to do if this doesn't work? What do I do for a job? What do I do for money? And you just start throwing yourself into a tizzy on top of itself. So I see, like I said, for decades, I've just watched this over and over and over and over. And I see people, they just are kind of lost. And they're always looking for that magical pill or that magical supplement or that magical whatever it is. And if you learn anything from this podcast, there ain't no magical anything. It's like, it's a combination of effort and energy and knowing exactly what to do and how to do it. And when you can do that, then you're going to start leading a pain-free life. And by the way, like I said, I'm 77. I have no pain. I don't have back pain. I see my patients like limping around and all the rest. And I explain to them, this is what you have to do. And when they start doing it, they start feeling really good. So.
No, that's incredible. 77 and no pain is
No,
for more.
and the other thing too is to create the body that you want. And that's why I wrote this book too, Achieving Unlimited Health. I wrote that, about 20 some odd years ago because I felt like, no, 30 years ago, I think. Now I forget. Been so long. I said, you know what? I want to teach people what health is. Because if I say to people, you healthy? They'll go, yeah. I say, why? Why do you think you're healthy? And they'll go, well, I don't know. I'm just healthy. I feel good. And I'll say, but why? What are you doing to make you feel good? Well, I eat right. Well, what do you eat? Well, I eat right. But what did you eat 3 weeks ago on Saturday? I don't know. Well, how do you know you eat right? Do you keep a record of it? No, most people
Mhm.
don't. I record all the stuff that I've been doing it for decades. Being into bodybuilding and stuff, that's what you had to do. You had to learn like what foods you had to eat to condition your body to take on the intense stress that you'd have to take on and build muscle. And it was, you had to document everything that you did from exercise to training, how much weight, how many reps, how many sets, how you felt through the workout. And then looking at yourself like 3 months later, because when you're training bodybuilding, you don't see like changes in results immediately, like the next day. You got to wait 3 or 4 or 5 months to really see big changes. So you have to utilize what I would call body monitors through your workout to know that you did what you were supposed to do to stimulate your body. And so, and most people don't do that. I still, don't you keep track of what you're eating? No, I know what I'm eating. I eat the same thing. Well, you don't. You're lying to yourself if you're thinking that. And it's the same thing with exercise. If you're not putting out what you're doing exercise-wise, you're not going to go anywhere. And if you're not doing the right exercise, you're definitely not going to go anywhere. So that's why I wrote that book. And I also wrote biochemical blood chemistry evaluation because I knew the best way to determine what kind of food you should eat and what supplements you should take is based on the blood test. Not anything else but a blood test, which all doctors would agree on. No doctor would say, nah, he's crazy. The blood chemistry doesn't tell you anything because that's what he uses. He uses it to look for pathology. I look at it to look at not only pathology, but abnormal physiology, which they don't even look at. So I start to look at things way before they become an issue, as opposed to them becoming an issue, then trying to deal with it. So I was always into preventive medicine. That's what functional medicine is all about. That's exactly what it's all about. So this is kind of where we end because that's how we care for the human frame. People think that when they exercise, they're caring for the human frame. They're not. They're conditioning the human frame. There's a totally difference. You can't condition the human body until it's functioning like a human body. Until all the joints are in fairly decent alignment, you're basically free of pain. Then you can start putting a program together, which is a combination of stretching, flexibility, which we train our patients to do, strength training, and aerobic cardiovascular. So those are the three types of exercise that everybody needs to do that. Stretching and strength training are the best because they keep the body in balance. Because we have a left and right sides, we don't basically utilize each side perfectly. And it's in one side, we always utilize more. So by stretching, we balance left and right sides. By strength training, we strengthen left and right sides of the body specifically. And then all the different joints, all the different major muscle groups are stretched and strengthened. And that's what you want to do to create that body that you want. That's going to be pain-free. That's going to be functional. And you throw it in the diet in there and you'll just create, you'll look at your body and go, wow, well, yeah, I'm really happy with what's going on now. And I feel great. So that's our next episode on how to condition the human body. Do you have any questions?
I think that was very informative and inclusive, but I was just going to say, basically, it sounds like maintaining physical integrity really supports the longevity and the quality of life overall.
Absolutely. Absolutely. Yep. You're not going to, and again, when you start hitting your 70s, I'm watching my patients, who can't just about barely walk. I mean, you're talking about, I can maybe walk from my car into the office, but can I go shopping? No. Can I do this? No. Can I do that? No. And I have patients that really take care of themselves and they're out playing, they're in their 60s and their 70s. They're playing golf. They're playing pickleball. They're, they're working out, but they're really taking care of their body. They're coming in for treatment. And they always with their dietary habits, they're really, they're not really overweight and they just want to live a nice, these people, a lot of them had, made a lot of money in their lives, and now they just want to have fun. But you're in their 70s and they want to be able to play golf. They want to be able to do all these different things, hang out with their friends, and they just want to enjoy this part of their life. They know they got maybe 10, 15, 20 years left, and they want to be as good as they can possibly be. And they just want to be happy.
Absolutely. And it starts, as soon as you can. I know I'm not there yet in my 70s, but it's just thinking about how
No,
to
yeah,
maintain and do all the right things so that you age without all these pains and medical and physical issues.
any other questions?
I think that was super informative. So thank you so much. I know I love visuals, so that's super
Well, that's why I
helpful.
want to try this one, because a lot of it is visual. And I would say that anybody that was listening to this that has some kind of an issue, on your next vacation, come down to Florida, get treated, let's go to the beach and be healthy.
Absolutely. Absolutely. I know when I'm in Florida, I'm going to make my way to see you in person for sure. But thank you, Dr. Cima. It was great as always. And I think this conversation really highlights that physical health is about far more than just pain relief. It's about really restoring stability, movement, and function, and how maintaining physical integrity can really support longevity and the quality of life.
You said it perfectly. I couldn't say it any better.
That's what I'm here for. But yeah, so thank you again. And thanks for showing us also that when the physical pillar of the triune is addressed properly, the entire body can really begin to heal and perform at a higher level.
Absolutely.
So be sure to follow the show so you don't miss our next episode as we continue building a complete framework for achieving unlimited health. Thank you again, Dr. Cima. We'll talk soon.